Let's get started. Let's go.
Ni Sánchez al punto.
Okay, everyone, I guess we'll get started. Today is Wednesday, November 16th. It's 11:15 in the morning, and we are about to begin the City of Laredo Blue Ribbon Committee for People with Disabilities. Our agenda, it says a call to order at the beginning, which we just did, then review and approve the minutes of October 19th. Because we are waiting for two more members, Jacqueline Rodriguez and Martha San Miguel, we will continue with item number 3. So, public comments. Do we have anyone who signed up for public comments?
No.
No? Okay, so 4, report from Christine Reyes, Special Needs Program.
Good morning. I did want to report that this month, actually on November 9th, we had a caregiver workshop for Caregiver Awareness Month for November. We had 49 participating families, and this was in collaboration with Partner Network Resource. So we were really happy we had those 49 families. And initially, we had about 65 registered, but 49 connected with us online. So we were happy to give out information. Of course, within that webinar or the workshop, we do start letting caregivers know about the tips, the resources that they have to assist them through their caregiving efforts. And then we also connected them with our Healthy Living program here that offers them diabetes prevention and management, just so that they can get free nutrition, as well as the classes Zumba, walking club, and biking club efforts for physical activity that they can focus on. Our program is currently continuously collaborating with our fire department to bring the STEER program into fruition. The STEER program is part of TDEM, which is the State of Texas Emergency Assistance Registry. This is an effort to register individuals with disabilities into a database so that if there is an emergency in specific areas, they can respond better and know what the need is of that individual or the community in that area. So we currently this past week we had a meeting with the TDEM representative, the coordinator, Samantha Pert, and we're moving forward to get all partners on board and then to work on the development of the STEER program for our county. So I'll continue to keep everyone updated on that information. Our Family Support and Community Resource Program is working on continuous education on flyers and videos for the Caregiver Awareness Month of the month of November. And we're currently at 477 clients as of the first quarter of the program, putting our program at a 477% target of clients. And that is my report.
Wow.
Yes.
I know all of us are always impressed with all that you're doing. Thank you so much.
Thank you.
Thanks for all you do. All right, discussion with possible action on Autism Coalition.
In terms of the Autism Coalition, we did hold our monthly meeting first Wednesday of this month.
November 2nd.
November 2nd. Christine provided the report on the town hall meetings that have taken place at the main library branch, and then today we will have an additional town hall meeting at the South Laredo Library branch today at 6, so anyone that could join us for that. We will be revisiting the questions that were posed during the first 2 town halls for the surveys for any additional responses for those that might have not been able to attend. And then we're going to expand a little bit and provide additional survey questions based on the preliminary responses to get more information on what activities the community would like to see for people with autism spectrum disorder, workforce opportunities for people with ASD, and caregiving, respite care for caregivers, just to get a little bit more information on that and start developing the master plan. So that's.
I know that there's respite care, if you will, through the schools, but is there something that is available after kids graduate?
I know Christine's the expert on that, so she does have some resources available for families. And that's kind of what we're trying to gauge, is if the community is aware of all the resources that are available.
Yes, there's agencies that are locally offering offering respite care, but we know during the pandemic, a lot of agencies shut down, if not
Yes.
paused some of their services, so they're already rebuilding the services. But majority of what we've learned also is that individuals that call in for resources, when I mention respite care, their initial response is, what is that? So we're wanting to learn a little bit more about if they are they have knowledge of that benefit through their insurance, and then also how to utilize it and request it. Because majority of the time, insurances won't tell you, oh, these are all your benefits.
Right.
It's the individual themselves that have to do that research. So we are looking into having several questions that look into that, to seeing how they, if they of course have knowledge of respite care, and also how they do it, how they obtain respite care.
Access.
Because respite care can be something done through an agency, but it can also be done within the household through a family member or a volunteer or a neighbor. So if they really fully understand the respite care support system that they have around them.
That sounds great. That sounds great. And then the other sub-item is air quality. Do we have an update on that?
At this moment, I do not. I know Dr. Chamberlain, and I apologize, he's unable to attend today. He's actually in Washington, D.C., giving a presentation on our COVID response at the federal level. But we are pending any feedback from EPA on the grant application that we had submitted. I know there's a meeting scheduled for this coming Monday, where they'll give us some additional information, and hopefully by next meeting we'll have some information
Remember,
for
we
you.
were at a kind of, our progress had been blocked because I understand that the feds wanted for us to test the air in very specific ways, and the machinery needed to do that was not available through the Texas air quality folks. Are we still there?
Yes, I don't think we've had any progress on that. I know there's still discussions on making sure that we comply with best practices both on federal and state level. So before we move forward with any type of purchasing of equipment, we want to make sure that we, we're a
The
steward
criteria
of funds, so that we are doing it in the correct manner.
Okay, sounds good. Are there any announcements?
The only announcement is the collaboration with the City of Laredo Health Department and the Laredo Health Coalition for the mobile health clinic village on Friday from 9 to 1. And of course, we're talking a little earlier, looking at the weather. We may move it inside, but emails will be forthcoming to those partners who are collaborating with us. So we're looking forward to that.
It's
Thank you.
Friday.
Yeah, Friday. Y dale. It's good. Initially, we were gonna have it the 17th, and then there was other stuff going on, so we moved it to Friday the 18th.
I do have an announcement, more so of some feedback. We had a presentation done with the Autism Coalition in regards to the Exercise Connection program that is going to be coming to Laredo through our program. We shared I believe we shared these slides through email, correct?
Yeah, I
Okay.
saw.
Some of the questions that are I do need, not questions, but see how we could get some feedback on dates for LISD and UISD to get the adaptive coaches and coaches on board for a workshop with Exercise Connection in person. So I wanted to see if we could get some recommendations on dates for year 2023 to work with the school districts on what is an ideal date. I know there's professional development days, but I'm not sure if those are days where an agency or organization from the outside can come in and do a training, or more so it has to be on a weekend or summertime. So I just wanted to get some feedback on how we can start working on a proposal for a date for both school
For
districts.
staff development with UIS, you would have to speak to Secretary Wada. She's in charge of staff development. There's certain staff development they allow, certain they don't. And for the adaptive P to be involved, it has to be doing staff development. If not, they have to make up the sessions so the students go to the therapy for adaptive P. If they don't search surveys, then they have to make it up. And then we have Special Olympics during spring also. So there's quite a few dates.
And ideally for the summertime, I know teachers are off. Is that an ideal time for some type of workshop for coaches, or is that, Chris, you don't even touch summer?
The other thing is that, again, to speak to staff development, we would have to compensate them. They don't work in the summer. We have to pay them.
Okay.
And that's financing, so I don't know if that would be approved or not.
Okay, so it's really getting some more information.
And the procedural ID is like a mirror image of the one I just described, it's the same.
No, it's great. I like the feedback because we were working on the proposal, and again, I want to make sure it works for both districts and even charter schools to come in and learn especially if it's a workshop, free workshop for them, and we're bringing these individuals to help give us more techniques and adaptive equipment so that physical activity is more available for children in the special education units.
I would email Celia because I know we have staff development, I want to say in January. So I don't know if it's district or campus wise.
Okay.
She emailed me and I'm trying to find the email. I couldn't find this. I'll be
I know what you mean, they're getting through a pile of email.
make
They'll
sure
find-
it's not what I deal with. It's listed somewhere.
Right.
Thank you so much.
And are we just restricting that to UNC or LAC, or is there an opportunity to maybe connect also the university?
We could connect, a lot of what Exercise Connection does, they also work with kinesiology divisions. So that they work on already again, Texas has yet to have it from what I've learned, is have a course in ABA services or techniques for the student to learn within the kinesiology realm. And the goal for that is, so they can create an inclusive environment if they have a student and things. But we are looking to seeing how Exercise Connection can divide that type of teaching, of course, for ongoing students, current individuals in the profession, and then also for recreation realm. So we're looking for ideas of course, with the proposal to see if we're going to have 1 to 2 workshops, or if we're going to have one workshop in different sessions for different professions.
Would that be something that could be of interest for
Absolutely, yes, definitely.
Thank you. That's a good question.
I cannot believe how quickly we're getting through.
You did good. You did good, Sandra.
I do have an additional announcement. So in the previous meeting, we did report that we had submitted for a grant application through NACHO for $75,000 on emergency preparedness in
Yes.
response for people with disabilities.
Yes,
I'm
I
happy
remember.
to announce that we were granted
Yay.
That's great.
the project. So Christine will soon have an additional staff member that will assist
Great.
with that realm. I know she's been doing great work with the fire department, so we definitely want to enhance those efforts. We do have another grant application in the pipeline for, it's actually autism spectrum disorder surveillance through the state. So it's just kind of monitoring the incidents in our communities and seeing what resources we can connect them through. That will get a response for in December. So we're very hopeful that we get that as well, and we continue to enhance the great work that Christine is doing.
That's
So there are state programs already in effect for kids on the spectrum?
They want to obtain data on the incidents.
Incidents.
Yeah, so I think that grant focuses on 4-year-olds.
Yes, it's for
8-year-olds
8-year-olds and
and
16-year-olds. 16-year-olds, it does focus on more of the transitional education for families.
Right.
But the 4 to 8, because there is a big gap on, especially since COVID, on red flags and being able to diagnose or late diagnosis. Typically, the late diagnosis happens at 8 years old. Because again, pediatric developmental doctors are circling back to those who were affected by COVID and not
Right.
were able to be diagnosed or assessed. A lot of it's derived from the CDC. This last 5 years, only 5 states in the whole U.S. were awarded this grant, and the CDC one program here that applied for throughout the state of Texas.
Wow.
Because of course, because they see the need. I mean, look at the numbers. I mean, it's on the rise and it's.
I agree.
Mhm.
You know, I don't know if you know this, but through the schools, we have a rule, 3 is 3, and what that means is kids with disabilities need to be identified, and a program has to be in place by the age of 3.
Mm.
That's been a sticky wicket for school districts because, of course, we have to wait for the referrals to come in. So it's a challenge getting the information out there for families to know that there's not only a way to diagnose kids on the spectrum within the school district, but that individualized programs are also available for them. And it's a challenge for schools to be able to identify, because they're, of course, they're not in control. They have to wait for referrals, but they do have the responsibility of having to, and I don't know, have you been a diagnostician?
Right.
That's always been a challenge, you know, to try to get all the kids who need it by age 3 and get them a program going by age 3.
Definitely. I know we were working, I had mentioned in our last meeting that we were working with the MOU with UT because our goal is to have early on-site screenings, and this is from ages 0 to 8 again. These on-site screenings will be dedicated for mobile assessment for developmental milestones, and then also working and collaborating with learning centers to help do those assessments to help send these families to our area. Again, learning centers are going to be key collaborators because they're the ones that see these children every day. They're teaching them, they're working with them on daily living skills, and they're going to see, you know what, there's a red flag here. And again, some families might not understand the red flags or think that, you know what, my child is hitting their milestones, but we also know that there's needed help with the pediatricians. Pediatricians are faced with seeing a child within a 20-minute visit and having to decide, okay, are they meeting all the milestones?
Mm-hmm.
So we wanted to make sure that they had the assistance on the assessments on the part of the learning centers, as well as the learning centers knowing where to get that second support system through
Right.
these screenings.
I don't know, remember when we were challenged with Child Find through the region way back? One of the things we started doing was putting posters up in pediatric, you know, waiting rooms. We put up a poster, did you know school districts have, you know, these services, call this number, as an outreach, you're trying to get those kids in by age 3.
And the best thing about these screening assessments, what we would like to do on site, is that one of the key elements that the university is going to help us provide is pathways. Again, once the child is assessed and diagnosed, what's next? Okay, well here, right next door of us, right here, you just got diagnosed, assessed, you know, there's some red flags, this is what we can do. This is what the next step is. Because majority of the time, whether there's an assessment, evaluation, or a diagnosis, some families are left to, again,
For themselves.
yes. So we want to make sure we have that all on site. And right now we are currently working on the proposal, working with the University of Texas of Austin to work on the MOU and MOA to get them to collaborate with their clinical director as well as their trainees for education.
Any more announcements, anyone? All right, well, I guess we can't approve the minutes, so I guess we'll bump that up to next time. I want to wish everybody a very happy holiday.
Likewise.
You know what they say, there's no calories for anything during Thanksgiving. Just enjoy.